Welcome to the Surevent Ventilator in-service training. This is the Surevent Ventilator. The Surevent Ventilator is a pressure-cycled automatic pre-hospital transport ventilator. The Surevent Ventilator is oxygen-powered, single-patient use, and disposable. Why should you use an automatic ventilator? Number one, to provide consistent ventilations, not too much, too little, too fast, or too slow. To continue ventilations when you as a provider will not otherwise be able to use a bag valve mask, such as transport across long carries or downstairs. Also, a portable ventilator is less likely to pull your ET tube or other advanced airway. So what kind of advanced airway devices or basic airway devices can you use the Surevent with? You can use it with a mask. You can use it with an ET tube. You can use it with a King airway. You can use it with an LMA. You can use it with a combi tube and any advanced airway that makes a seal. Indications for using the Surevent include respiratory or cardiac arrest. There are only a few contraindications for the Surevent. The most important is that you cannot use it on any patient under 90 pounds or 40 kilograms. You cannot use it if you have an inadequate O2 supply or if you don't have an adequate seal on your airway. Frequently asked questions. The Surevent ventilator uses about 15 to 25 liters per minute typically, the same amount as a regular bag valve mask. The Surevent will use more oxygen if connected directly to the high flow port of the portable oxygen tank and go through a D tank in about 10 minutes. The Surevent is not difficult to operate. In fact, most of the factory settings will be adequate to ventilate most patients. Like any patient in respiratory and cardiac arrest, however, any patient under the Surevent will have to be monitored closely. You can still use a bag valve mask to check airway placement if you wish, but you can also set the Surevent ventilator and turn up the rate. In this way, you can check lung sounds and epigastric sounds to verify advanced airway placement. Changes and trends in the patient's ventilatory condition will be evident through changes in the manometer, the patient's ventilatory rate, and on the end-tidal CO2 monitor. These monitoring devices are typically much more sensitive to changes in the patient's condition than the typical bag valve mask operator. This is certainly true if the lead care provider or person in charge of making patient decisions is not the person with their hands on the bag valve mask. Ventilators like the Surevent are used regularly by agencies all over the country for both emergency and non-emergency transports. Use of the Surevent by EMS has been studied and validated. So how does the Surevent work? Here you have the screw-on connector and oxygen tubing. On the back side you have the air valve. You have the pop-off pressure relief valve, patient connector tubing. We have the manometer in low, medium, and high indications. We've got the PIP, or peak inspiratory pressure knob, that controls effectively the volume. And we have the rate knob with simple slower and faster settings. Now, let's take a look at how to use the Surevent. First thing you want to do is screw the oxygen tank connector to the portable oxygen regulator and turn the tank on. There's no need to set the portable regulator. If you're in the ambulance, you can connect it directly to the wall outlet. In this case, you'll need to make sure the valve is on and turned all the way up between 15 and 25 liters per minute. Next, confirm that the oxygen is flowing through the Surevent ventilator. You can do this by covering up or touching the end of the ventilator. Next, you can connect the end-tidal carbon dioxide waveform monitor device and any other devices that you need to have inline in your breathing circuit. Finally, connect the Surevent. The ventilator should now be working. As you see, the patient will have chest rise, and here we can clearly see the lungs, and the manometer will be going up. At this point, you want to check for any air leaks in the system and adjust the pressure with the PIP valve. The preset 25 centimeters should be adequate, but you may need to go higher. Here we're looking for chest rise. If you're checking for the position of your advanced airway device, you may want to have the patient breathe faster so that you can check lung and epigastric sounds. Once you're ready for transport or regular ventilation, your target is going to be approximately 1 breath every 5 seconds. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000. You must use end-tidal CO2 monitoring every time you use the Surevent ventilator. End-tidal CO2 monitoring will guide your ventilation with the Surevent just like it'll guide your ventilation with the bag valve mask. Your target, as shown here, is 35 to 45. That's the normal range for end-tidal CO2, but even during cardiac arrest, your end-tidal CO2 should be at least 10, if not 10 to 15. If the patient's CO2 rating is above 45, you're ventilating too slowly. If, as is more common, your end-tidal CO2 reading is below 35 or below 10 in cardiac arrest, the most common cause is that you're ventilating too quickly. Slow down. Now, confirm airway placement and, of course, continually monitor your patient. Now that everything is set up, we're going to need to secure the Surevent device. Here we're securing it directly to the backboard, but you can secure it in any way that's most appropriate for your situation. In emergency situations, problems arise. Here's how to troubleshoot the Surevent. If the ventilator fails to work, stops ventilating, or begins to cycle very rapidly, watch for a kinked or blocked airway. If the ventilator fails to operate, check your oxygen supply to see if it's reduced or empty. Of course, always document your ventilation settings and the operation of the device in your EMS chart. Well, we're coming to the end, so let's take a moment for a quick wrap-up and review. The first thing that we're going to want to do is connect to an oxygen source, whether that's a portable regulator or the onboard oxygen supply in the ambulance. 15 to 25 liters per minute is a minimum. Although the Surevent is factory set to be ready to ventilate when it comes out of the package, you'll want to verify that the PIP, or peak inspiratory pressure dial, is set to 25 centimeters of water. That should be adequate to ventilate most patients. Then, after verifying that the oxygen is flowing, connect to the patient. Set your breathing rate with the rate dial. After that, you'll of course want to continually monitor your patient and adjust the Surevent ventilator as needed. Well, that's it. Thank you for attending this Surevent ventilator in-service training, and please remember, don't intubate Gus.